Hi, welcome back. And it's a privilege to have in the studio today an eminent cardiologist from Jamaica, Dr. Edwin Tulloch-Reid. How are you, Edwin?
I'm well, thank you, and it's great to be in Australia.
Yes?
Yes.
So heart surgery, that...
Actually an interventional cardiologist,
oh, okay. Well,
which is, you'd regard it as surgery, but we call it endovascular surgery. We put wires and balloons in arteries and unblock them. That's basically what we do. So it's, the first time is always exciting, but you know, we prefer the less messy, you know, percutaneous through the skin approach to fixing the hearts.
So you're not necessarily unzipping people
Absolutely.
down the sternum and cracking them open?
We think we should, you know, one should avoid that kind of trauma. At least patients are better off without it.
Yeah, less invasive.
Yes.
And although that, I mean, surgery is a fairly traumatic thing for a person, but the difference between, you know, before and after, what do you see?
Difference is as interventional procedures done, you can go home the next day. Surgery, it's several weeks, several months, sometimes to fully recover.
Wow.
You know, but the difference between surgeons and physicians is sort of blurred now because surgery is becoming less invasive and medicine more invasive. So it's like Star Trek. You're just a doctor.
Yeah.
Yes, a little bit.
Now, in the developing countries, in our region, Edwin, historically, you know, there was a lot of problems with infectious diseases, you know, malaria and that sort of stuff. Now things are changing.
Absolutely.
And it's now lifestyle diseases that we're tackling in the South Pacific nations, which matches the sort of disease burden we have here in Australia and New Zealand. Has there been similar trends in the Caribbean?
Same epidemiologic transition, they call it, to it's heart disease, diabetes, hypertension. There's not much of infectious, in terms of infectious agents that can, maybe HIV, which is sort of the modern plague, but it's similar to the problems you have here in most developed countries. Yeah.
Totally preventable?
Yes, largely preventable, yes, lifestyle. And that's why the sort of our view of a holistic being, you know, and a holistic approach to, you know, in terms of lifestyle changes, in terms of preventing disease is a lot better, works a lot better, it's less expensive and more effective than sort of look at the other end, the curative and purely curative. And when you have expensive therapies for, you know, for bad diseases. Hard.
So do you say this to your patients? Do you say, listen, the operation was a success, you're free to go home. If you want to avoid a return back here, here are a few tips.
Yes, well, here are a few tips, and you probably need more than that. You need a program. And actually, I work for, you know, the Adventist Hospital, the Andrews Hospital in Kingston. And
in Kingston?
Kingston, yes.
I love it.
As well as a freestanding cardiac center. And they both are fairly technologically advanced and sophisticated, but we have to balance that with a healthy lifestyle approach. And both institutions have lifestyle centers. You know, at least, well, the Heart Institute has a lifestyle center we call Breath. The Adventist Hospital there's a strong presence in terms of vegetarian diet while you're there, no smoking, no coffee, so you're sort of
alcohol,
being re-educated.
no
alcohol, obviously. You're being re-educated while you're a patient at the hospital.
Do you think the message is starting to get through in the general community that, you know, what people think as, you know, normal lifestyle practices are actually quite dangerous to your health? That's
true. In fact, one of the big issues is physical inactivity, and we've discovered what came out of the meeting I was at in Melbourne is that physical activity in women may be probably one of the bigger risk factors. Not exercising regularly is as bad as smoking 4 cigarettes a day.
I heard that, they say sitting is more dangerous for your health than smoking. I mean, that's scary.
So actually in Jamaica now, strangely enough, we have a lot of run-a-thons and walk-a-thons.
Usain Bolt, of course.
Yeah, well, obviously, you know, there's, you know, we have famous athletes. And, so we have a, you know, that's interesting, and we have something to build on in terms of our tradition, as you know. But then obesity rates are very high and climbing, just like Australia and in the US, and that's something that's, as you get more prosperous, because Jamaica is now reclassified as an upper middle income country.
Okay.
Yes, so we can't get aid, unfortunately, anymore.
Yes.
But it's so we have you know, first world type, developed country type health issues to deal with. So it's part of coming of age, unfortunately.
Goodness. Now, Edwin, you speak, was it 4, 5 languages?
Well, I speak English, obviously my native language, but I also speak French quite well. And I speak some German and Spanish.
So you're obviously a very educated man. You're very well respected in Jamaica. A part of your training involved working in the training in the US. You've been to Canada.
Yeah, French Canada. Yes.
But after all that, you've returned to Jamaica. I mean, with someone with your training, surely could have easily, set up a a posh practice in a nice suburb in Boston or Portland, Oregon, or somewhere without some of the social problems that are associated with Jamaica. Why did you go back?
There was sort of a Christian commitment to service, and it's something that sort of your family, being the way you were raised. My father was a public servant. My mother was a teacher, and so there's a strong commitment to service, and to have a very strong Christian upbringing. And I never thought for a second about staying. I did board certifications. I have a U.S. license, but I never thought. I always thought about coming back. And it's interesting because now the book of Isaiah, the prophet says that you hear a voice from you turn to the right, turn to the left. There's a voice behind you saying, this is the way, walk you in it.
Yes.
And you think there's a path that your life has to take, and it's ordained by the Almighty. I think it's just for you to choose to follow His lead. So I think in coming back home, it's a great opportunity to serve and to make a difference. If you remain in North America, you make money, you have a good life, but at the end of it, what do you have to say? You have to give an account for what you've done with your life and your talents at the end of. And that's what we believe. So it's been a very interesting journey. It's been exciting. It's been fulfilling. It's been challenging, but I can't regret. There's no regrets.
So just as we finish, Edwin, there may be a number of our viewers who are maybe younger people, maybe thinking about their future, thinking about their career. Maybe they're thinking about medicine or a medical related field, nursing, physio, or whatever that is. Those professions have a reputation of being quite well paid and having a lot of a lot of status and privilege attached to them. But you're talking about service.
Yes.
Any advice you could give to maybe some of our viewers who maybe are thinking of a medical career?
Well, you have to have a passion for it, and you have to be called. There are other avenues for creative expression. There are other ways to serve.
Sure.
So unless you feel a calling and to medicine, I wouldn't necessarily, or to health-related profession, don't necessarily go into it. You're doing a very good thing here. You're having an interview program, you're broadcasting, and that's just as important. But I think it's a wonderful opportunity, though, if you feel that calling to serve. So I wouldn't dissuade them, but realize it's a long road and it's a challenging one.
So saying don't do it for the money. Do it for the money. Do it for the passion.
Do it for the passion. Yeah. And because of your commitment to service.
Service.
Yes.
Love it. Hey, thank you so much for your time, Dr. Edwin Tulloch-Reid.
It's been a pleasure. It's been great being here. Yeah.
We'll be back straight after the break. Hey, really appreciate that.